there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today we're going to talk about the why behind IPH. So I think it was the beginning of the pandemic. Kathy and I were chatting with one another, and I had a 6-month-old at the time. And we were just chatting, and I was like, it would be so cool to educate clinicians that don't really have much training in the pelvic floor to assess for the pelvic floor, so that we're not seeing patients that are 5 years plus with pain that have been misdiagnosed, not knowing how to find pelvic floor therapist. And so we joined forces, and Kathy being an NP, we really wanted to provide this care to NPs and CNMs.
Because it was missing in my education. I remember
Right.
thinking, did I miss this? I did well in school, and I remember thinking, did I just miss this whole part? And the answer was no, I did not miss the whole part.
Yeah.
And what was very important to us is that we thought about how could we have the biggest impact. We always say, join us to revolutionize pelvic health. And the way that we really feel we can do that is by empowering nurse practitioners and certified nurse midwives to really think about and educate them on how to do these pelvic exams, because that's to us where then the impact will be enormous. Everyone loves their NP, everyone loves their midwife. And I know Melissa always, she laughs when I say this, but who better than you, really? Everyone loves coming to their NP or their midwife. You're sad when you have a baby and you don't see your midwife anymore, right?
Yeah.
So this is the perfect way, we feel, to really have a huge impact. And as a nurse practitioner who's learned so much about the pelvic floor, it's given me so much confidence. And it's really nice to have an area that I know a lot about, coming from primary care, or even when you're a general women's health nurse practitioner, you have to know so much about so many things. And this is a lovely specialty to add in that'll help you potentially to see more patients, to be more valuable to your practice, maybe even to do what I did and, find a physical therapist like Melissa and open up your own practice. But the impacts of this are just so huge, and we're just so excited.
Yeah. And there's such a niche for it, and the ability to really specialize. We're in Boston, and there's really no good primary care or GYNs to refer our patients to that have significant pain. And so I wish we could clone Kathy a zillion times so that we would have more people to refer our patients to, because it's really hard to find someone who's not going to traumatize our patient. So we felt like this was so needed, and we hope that by educating, we can really just create this specialty within the NP and CNM population so that you guys can really take off and help all of our patients with pelvic floor dysfunction.
Absolutely. And that's a wrap. Did you like this video? If so, hit like and subscribe, and please share with your colleagues and let us know your biggest challenges in caring for your patients with pelvic floor dysfunction.
And subscribe to our email list at instituteforpelvichealth.com to get your free guide, 4 tips for managing your challenging pelvic exam.
And when you get your free guide, you'll also get access to our weekly newsletter full of real pelvic health education you can use with your very next patient tomorrow. And we're thrilled to announce our AANP accredited online course is now open for enrollment. See the link below to enroll.
Our AANP accredited online course Beyond the Kegel is 6 modules packed with practical information that you most likely didn't get in your training. You'll get videos, templates, patient education handouts in English and Spanish, hands-on demos, everything you need to confidently help your patients with pelvic floor dysfunction. And sign up for Beyond the Kegel to improve patient outcomes and your provider experience and become like Kathy.
Thanks for watching and spreading the word. Now join us. Let's revolutionize pelvic health. We'll see you soon.